Good afternoon, everyone. I'm Lois Irwin, President and co-founder of Easy Access MD, and I'm here with Robin Flaherty, President of Benefit Link. I'd like to first introduce us and Easy Access and what we do, and then we'll bring Robin into the conversation as an advisor who has used the Easy Access MD benefit with her clients. So just first a brief description of what Easy Access MD does is a combination of mobile urgent care with telemedicine. And that combines to produce an episode of care that happens all in one day when the telephysician orders a mobile unit to come to the patient's home in about 2 hours and perform a variety of tests, including x-rays. You can see here a picture of an x-ray machine being unloaded and then brought into a patient's home. So you may think, well, this is an unusual combination. How would someone ever find themselves at this place in life? So I'd like to share with you my origin story. My first job after college was working in West Africa at a mission hospital, and that mission hospital was just developing their own mobile unit. We traveled to small villages far from the clinic that were too far for the patients to walk and receive care. So we drove a van and dispensed care in the village, primarily for mothers and young children who were suffering from malnutrition and a high mortality rate for those young children. So in that experience, I saw the value of bringing care to the patient when the challenges of distance and cost were barriers where they did not receive care. And then fast forward a few years in my career, I was with my husband, Will. We ran a portable x-ray company that served frail elderly patients, and in a similar way brought care to patients who were unable to travel. It's a service that was covered by Medicare, so it removed the cost barrier, and they were able to receive x-rays and ultrasounds and cardiac studies in the comfort of their own home without having to travel. So those experiences really reinforced with me the value of bringing care to the patient, and we saw an opportunity to combine that with emerging telemedicine and bring that benefit to the under 65 population. We'd already been serving the over 65, but bringing it to the under 65 population, and that's what brought us to the employers that we serve today. And along the way, I was fortunate to meet Robin Flaherty. And Robin, could you share with us your story of how you ended up in this unique position?
In this room? Can you hear me? Yeah. Thanks, Lois. So by trade, I'm a CPA, and as fate would have it, when I was working at Coopers & Lybrand, now PwC, I was in the tax department. And research projects would always come across my desk on the taxability of fringe benefits, and it just really started interesting me. And so what I,
Robin,
just kind of fast forward.
Robin, can you hold the mic a little closer to your mouth?
Oh, is that better? Okay. And I've kept my license up because, as you can imagine, it was a pretty long road to get that. But it's easy to keep it up because benefits touch so much of the tax law. And so when I started working in this space, I actually had an opportunity. When I left public accounting, I had an opportunity to work for a company that was the old, well, actually still is the old employee leasing, but a professional employer organization. And that was just that's an all-in-one package of benefits and workers' comp and HR. And it ended up being 2 years of paid market research for Benefit Link because everyone I spoke with about the PEO really just wanted the benefits and the compliance. And so in 1995, I started Benefit Link, and it was really kind of right on the front end of healthcare becoming the second or third largest expense on the income statement. And because of the different relationships I had met in public accounting, I was able to, have a few clients. I knew CFOs and controllers that were pulling their hair out over this expense and how to manage it. And so that's where I, really kind of found my place. And I've been running Benefit Link now since 1997. And I met Lois in 2017 in a women's group. And immediately I saw the value of Easy Access MD for my clients and started bringing this solution out to my clients. They were looking for different ways to manage their costs. But also I have, it's interesting, we'll talk a little bit more about what the pandemic has done to employee benefits in a few minutes. But really, ultimately, these clients here that I have that were interested in Easy Access MD, kind of the early adopters, they're really the ones that already had their finger on the pulse of the value of, the convenience that the service brings to their employees, but also the cultural value that it brings them in now in our post-COVID era. Just the importance of that, cannot be stated anymore. One really great testimonial that one of my clients at Park Grove Realty experienced is this woman, Yvonne Racchianello. I'm sure I just butchered. Sorry, Yvonne, if you're watching. I'm sure I just butchered your last name. But she had an interesting situation happen, which I think typifies the value of Easy Access MD to clients and their employees, is that Yvonne and her daughter were at a field hockey tournament for the weekend, and her daughter took a stick in the side of her torso, and of course the pain was so severe that they thought there could be a cracked or broken rib. Yvonne's driving her daughter home from Syracuse, New York. She lives in Rochester, about 2 hours away, and she was thinking, I got to go to urgent care and make sure that, her daughter's rib isn't cracked or broken. She was, of course, dreading, I'm sure it was a long, if anyone's had a long weekend of taking their children to tournaments for the weekend, it's not relaxing at all. It's quite a bit of work. And when you get home on Sunday, the last thing you want to do is go to urgent care or the emergency room. Well, Yvonne realized that her employer has Easy Access MD, and she had the phone number on her keychain and called Easy Access MD. A real person answers the phone, and got her connected with the doctor on the way home in the car. And the doctor and Easy Access MD was able to coordinate that when Yvonne came home, within a half hour, Easy Access MD was in her driveway, and her daughter got the x-ray of her ribs in the comfort of her own home. So I just think that really typifies, so there, Yvonne, I'm sure, was even more rested on Monday morning because she didn't have to, after a long weekend, go to an urgent care or possibly an emergency room. So that's
and
kind
Robin,
of in a nutshell.
How much did it cost, Yvonne?
Nothing. Yes, right.
So that leads us to really hone in on what are the benefits of Easy Access MD, both from the employer and the employee's perspective. So we call it the 3 C's impact, and the first one is cost. So it was free for Yvonne, so that was terrific. But what about for the employer? So the employer reaps savings because employees are no longer using the expensive emergency room, the expensive urgent care, or even having to wait a few days and see their primary care. And we have a case study that we'd love to share with you that has the particulars of how those savings have unfolded for that particular employer. The other component of benefit for the employer is productivity, because when an employee isn't there, they're not working, things don't get done. So we've put some measurements together to be able to show employers the financial benefit of having employees more at work, reducing absenteeism. And when we combine those, it works out to savings of over $500 per episode of care every time an employee uses our service instead of those more expensive bricks and mortar alternatives. And then the convenience is the second C, and that gets to what Robin experienced with her employee client of having the service available so readily. We know from research that Google has shared with us that 20% of all searches done on Google are for healthcare. And of those searches, the single biggest search is, where is the urgent care nearest me? And when do those searches happen? They happen early in the morning at 7 a.m. So you can see from the screenshot, we looked this morning in Orlando at 7 a.m. and were there any urgent cares open? No, they were all closed. But Easy Access MD is open 24/7, and at 7 a.m. we could have been doing an x-ray or a strep test in a patient's home in the Orlando area. And again, we do that on short notice within just a couple of hours of the order coming in. So then there's the other factor of the 3 C's is culture. And Robin, I think you're in a great position to share what the cultural impact is.
Sure. Well, it's interesting. Yeah, I've presented a few times to a couple different groups, and they wanted me to talk about how the pandemic changed employee benefits. And the research that I did led me to this new, and perhaps many of you have heard of it, this new category of benefits called emerging benefits. And really, emerging benefits, there's now traditional benefits, and now there's, complements of the pandemic, there's this new category called emerging benefits that supports the holistic well-being of the person who comes to work. Some of my other research was showing me that the word employee really isn't used much anymore. It's the person who comes to work. And so, what I thought was interesting is that MetLife does a benefits survey every year. And the year before the pandemic, benefits, custom benefits, was number 5 of top 5 drivers of happiness at work. Whereas post-pandemic, the year after the pandemic, it's actually 2 of the 5 trends impacting the workforce. It's number 2 and number 4. Number 2, employees are worried about their well-being, which is impacting productivity. Well, again, I'm sure Yvonne was well rested on Monday because she didn't have to worry about, that couple-hour trip or more to urgent care on Sunday night after a long weekend. And number 4 was, just in general, employers are boosting their employee benefit programs to support the person who comes to work, that builds their resilience and supports them, for dealing with all of the issues that they deal with in their life. And so, again, my clients, our clients, speaking to other advisors out there, they expect us to have these solutions, and bring them to them. And I believe that, I was fortunate to have Easy Access MD in my hometown, in my backyard, and be able to be the first one in my marketplace that was out, talking about Easy Access MD and bringing them this innovative solution that does, cut costs, for not only the, when you cut employee costs, you're also by default cutting employer costs, and it's boosting the, their productivity, and it's also it's a culture building benefit as well. I just think it checks all the boxes. Because really these emerging benefits, they need to support that holistic well-being. And traditional benefits really just, they're still very important, don't get me wrong, but there's this shift now to, supporting your employees and helping them deal with and navigate all of the new issues. Because, technology started erasing the line between work and life, but COVID came along and just completely erased whatever faint line was left. And in the survey, actually, I read this one quote where this guy said, "The good news is I can work anywhere I want. The bad news is I can work anywhere I want." So, and it's so true. But a benefit, I believe, being able to have this in my, it's probably cliched, toolkit as a lever that my employers can use to not only contain their costs, but to keep, to show their employees how much they care about them. Because ironically, I had asked the chief operating officer at Park Grove for a statement about, what does Easy Access MD mean to your company? You've had it for a couple years now. And the one thing she said that really supports what Yvonne experienced was, I know our employees really appreciate this benefit. And, I know that my clients that have this benefit, it could be coincidence, but their turnover is very low and their open positions are very low as well.
Robin, thanks for sharing that with us and also talking about culture, and we had mentioned the impact of COVID. So prior to COVID, the utilization of our service across all of our employer groups was about 60% annually. So I think you're well aware of utilization rates, typically for telemedicine, have been in the single digits. So we're experiencing fairly high utilization prior to COVID. And then with COVID, more and more people used us because, of course, they're at home. It's very convenient for them. So last year, our utilization was over 80%. And that's important in that you're changing the culture, you're changing behavior of what people think about when they need care. They remember, oh, I've got that benefit. It helped me last time, or I heard how it helped a coworker. So then they increasingly turn to us. And we find over time that a client's usage increases year after year as word spreads and adoption increases within the organization. So the cultural piece is very important as we're changing behavior in a positive way and in line with all of the other cultural changes that are happening in the workplace and in people's lives in general. So Robin, thank you so much for coming and sharing your experience and that of your clients with us today. And I'd like to sum it up by saying that we have more to share with you about how we can help mitigate the risk and provide cost savings for your employer clients, whether they are fully insured or self-insured or somewhere in between. And we've set up a webinar on April 11th with Dave Chase as our guest speaker. And we encourage you to register, and you can just scan the QR code right now and sign up, and it'll be on your calendar for Monday, April 11th at 11 a.m. Eastern. So at 11 on the 11th. We hope to see you then. And in the meantime, for today, are there questions that any of you might have that Robin and I could help answer? I know there's a few online. But we have a question.
We need to make sure that all the questions are on the mics so that people online.
So we have a question right here with this gentleman.
Thank you so much. I came in late, so what states are you in currently?
Yes, so we are in 23 states with mobile service and all 50 states with telemedicine, and it's primarily the Southeast and the Midwest, and including now Florida. We've just opened in Florida. So, and another question here?
Well, if you'll let me embellish before I ask my question. I found out about you guys through Mitigate Partners, and I was compelled to mention you to a client after this event. An employee woke up in the middle of the night, sleepwalking, fell down his stairs in his apartment, was jolted awake, and then went back up to his room and went back to sleep. So then the next morning he woke up and thought to himself, I should really go get checked out. So he goes to the emergency room. The bill charges for that.
Even closer.
The bill charges for that encounter was over $26,000 to my client. And I thought to myself, Oh, you terrible benefits advisor. You should have told your client about Easy Access MD before now. And so, shame on me. I finally did it after that experience. And ever since we've had it in, we've had great utilization and lots of good stories back from employees about how wonderful you guys are. So, having said all that, I want to know what the future is, because every company is innovating. I'm sure you're already looking into the future, so I want a glimpse into the future from you guys.
Christy, thanks for sharing that story, and thanks for the question. And yes, we are always looking at what additional benefits, ways could we be helpful to employers. And we expect that we'll be adding perhaps additional tests. We're doing some early piloting of a blood analyzer that could be brought to the home, but that's probably a ways down the pike. But what is closer is that in April, we will be announcing our behavioral health program, which is a little different than many behavioral health programs that are out there today. It's a behavioral health coach who will take incoming calls from the patient and help the patient with that episode, and also act as a triage point for everything from a suicide concern. So again, that would be an immediate high escalation to other issues that can be handled over time. So we look forward to sharing more about that next month. But thank you for that question. And one back here.
Okay, I have probably 3 questions. Are you in the state of Alabama?
Yes, we serve portions of Alabama, and if you have clients in parts we don't serve, I'm sure we can extend service there.
And then what is your pricing?
Oh, thanks so much for asking about the pricing. We price on a utilization rate basis, and our prices start at $1 per employee per month, which covers utilization of 5%. And then we adjust every month depending on their utilization. So let's say after 1 month, their utilization had been 20%, then their bill would be $4 for the next month. So that price goes up and down over the course of the year as their utilization changes. And that's one all-inclusive price. It's the only money that changes hands. There are no additional payments, no co-payments by the employee at all. You don't get a bill from a radiologist a week later, etc. And if you have clients who would prefer to have a flat rate because they don't want variation in their monthly expenses, we can work with you on that as well. So we would do a flat rate for the year with a true up at the end of the year.
So that includes like at-home visits?
Pardon?
That includes the at-home visits?
And that includes the at-home visits. That's right.
Okay, so you said your utilization after COVID was 80%. Mm-hmm. Outside of word of mouth, what is attributing to like that high utilization?
So when we enroll an employer group, we make every effort, as everyone does, to get the awareness, but we actually send a package to their home that has not only a card and our keychain, but also a refrigerator magnet. It sounds low-tech, and it is, but you'd be surprised the number of patients who have told me, oh, I remembered the magnet on the refrigerator, and I went there to use it, to get your number and call. So then we follow up with the employer. We put posters in the workplace, sometimes digital posters if they have the technology for that, and then we monitor an employer's usage. And if their use is too low, then we unfurl a campaign to boost utilization in that group. And any group that's below 30% we view as a low utilizer who needs extra attention. And I would just say the other thing that I would attribute to our high usage is, from an employee's perspective, once they remember to use this, oh right, it's free, I don't have to enroll, So you're automatically enrolled when we receive the census from the employer. You don't have to log on and create a portal and set up a username and a password and put your credit card number in. So all of that goes away. So we are all about, easy access, it truly is how we think about offering our service. And we believe that that has made a big difference in the high adoption of our service. And because employees know that someone could come to their home if needed, then they realize, oh, this is more than just calling a doctor. This means they'll come out to my house if I need it. And that makes an impression on them. Yeah. So.
That's how Yvonne remembered she had the service and was able to get a call. She had her keychain.
Right. Oh, and one here and then one here.
Can you do a projection for a potential employer client to help them understand how much they might benefit and how much they might save?
Sure. If you have claims history from your clients, then we would love to take a look at it with you. Typically, we have an impact, and we've talked about primary care, urgent care, and ED visits, and we can help cost out what that would be versus our services. Our clients usually see that the savings that they achieve with us is much greater than the fees that they're paying us. And a lady here?
I noticed that on your map, I just quickly looked because I'm from the Northeast Boston, and you've got 3/4 of Massachusetts, which is fantastic, but it looks like southern New Hampshire. So if I've got employer groups that are in New Hampshire, I thought the Georgia question was, well, if there's little outlier towns, we can make that kind of work.
Yep. So
that would be great. Okay.
Right, so we basically have the Boston Metro covered as it extends into southern New Hampshire, but
Correct.
if you have a larger group a little north of that, then I'm sure we can find a way to serve them.
Okay, fantastic.
Great.
Thank you for your presentation. Any plans on expanding to the west, specifically Southern California?
West?
Southern
Yes,
California.
our expansion in the west will start in Arizona and Nevada. Is where we would be there. Right now we have Oklahoma, and we'll be bringing Texas on later this year. Who wouldn't love to be in Southern California, right? Of course we would love to be there. But if anyone's ever been a healthcare provider in the state of California, they make it exceedingly difficult from a compliance regulation perspective. So it's on our roadmap, but I'm sorry, you're probably from California, and it's just not, this year or next.
I'm from Nevada. Wondering, are you starting in the Las Vegas area?
Yes.
Okay, just checking. Thanks.
Yes. Okay. Would love to talk with you.
One other question: is there a minimum employee size?
So we'll take groups as few as 5. And the sky's the limit in the other direction. So, great. Well, thank you for all of your questions. We appreciate the interest. We look forward to a follow-up conversation. When we're available, we're here and online, and we have our seminar on April 11th. And I just want to thank Robin again for, first of all, it was great how we found each other, and then how she saw the value in what we do, and how we've been able to work with her customers as early adopters and really proving out the benefits that they receive when they work with us. Because I know that's the validation that you like to see as you bring us to your clients. So.
Well, and I know this sounds very little hokey, but I do thank you and Will for your vision, because I'm involved with Health Rosetta because I want to have my finger on the pulse of all of the new adoptions and the innovations. And again, it's kind of your origin story is very cool. About how, and it's stepping stones, right? I mean, when I was sitting in my cubicle at Cooper's and Library, and I never in a million years thought I'd be standing here, and really have a passion for fixing healthcare. From a cost perspective, it is the second or third largest expense on the income statement, and I have a real passion for for helping employers with that, and employees, right? It goes hand in hand.
Right. And of course, that's what we love about working with all of you. We have that shared passion for helping employers and employees and changing the healthcare system in this country. So thank you.
Thank you so much, Lois. Thank you, Robin.